Welcome to your Neighborhood Network. My name is Andy Henderson, and today we're at a great place. I'm at Neuropathy and Pain Centers of Las Vegas, speaking with Dr. Robert Odell. Doctor, please tell our viewers about yourself and your centers.
Thank you, Andy. I'm an interventional pain specialist, originally trained as an anesthesiologist at Stanford and UCLA. I became aware of the benefits of energy medicine in the 90s and have extended that to the utilization of electricity and electronic signaling for the treatment of neuropathy and other pain syndromes. We've been doing that for the last 7 or 8 years, and I've been getting fantastic results with the patients with really very little risk.
Doctor, at what age do people commonly get diagnosed with peripheral neuropathy?
Usually it's people who are over 60. Sometimes we see people in their 40s and 50s who, for example, may have aggressive diabetes. Those with neuropathy from diabetes can get it earlier, but those people, most of the population, they're in the older age group. A lot of folks are in their 70s and 80s.
Doctor, what are some of the symptoms of peripheral neuropathy?
Peripheral neuropathy is more than chronic pain. There's positive and negative symptoms. People can have burning, dysesthesias, which are electric shocks that are unpleasant. They can have paresthesias, which are electric shocks that are pleasant. They can have numbness. They can have tingling. The numbness is considered a negative symptom. As a result of this, they'll have difficulty walking, balance issues, gait issues, fear of falling, a whole spectrum that goes really beyond just chronic pain.
Doctor, do you prescribe medications to help with the pain?
No, usually we don't. We're using energy medicine, a combination of chemicals and electricity, electronic signaling, to essentially heal the cells. That's exactly what we're doing. The treatment's over a couple months, but we're healing the cells, and we are actually helping the people to get off their medications, the gabapentin, Neurontin, and even some of the narcotics and drugs like tramadol. And we allow the patients to self-regulate to get off these things.
What if a person is interested in getting treatment, but they're not sure if they have peripheral neuropathy?
We have a diagnostic test that we use called NeuroScan, which I actually helped develop in the middle 90s. It's a painless test that will actually tell you the level of the pain generator in the legs, in the hands, if it's coming from the neck or the back. It's a great test that can be repeated so we can follow the progress of the neuropathy, one of the nerves that's affected by neuropathy, in a way that can be followed, and we can get objective proof, which is really excellent for the third-party payers.
Tell us about your revolutionary treatments and what patients can expect after the treatments are completed.
Many patients can return to activities that they couldn't do before. Biking, hiking. I had a gentleman who was morbidly obese. After helping him with a peripheral neuropathy, this patient was able to walk for 2 hours a day, and he was losing 16 pounds in a week on the basis of himself helping himself by doing this exercise.
Doctor, may I talk to one or two of your patients?
Absolutely.
What was your condition, and what do you think of these new treatments?
I had neuropathy in both feet, and I had burning and a lot of pain, and since coming to Dr. Odell and getting the treatments, I'm out of pain, I'm back on my feet, I've lost 30 pounds, and I'm in my own shoes.
What was your condition, and what do you think of this new treatment?
I originally came here because of foot drop secondary to peroneal nerve injury and with neuropathy. The treatments have been so successful that my foot drop is almost resolved, and neuropathy is less than 50%. It's the best thing since sliced bread.
Doctor, these patients seem to think you work magic. What would you like to say about your treatments?
Well, our mission is really to provide this revolutionary treatment to as many people as possible to relieve their discomfort from this debilitating syndrome. Those people who have neuropathy know how bad it is. And we would ask you, please come in and let's take a look.
I'm a patient, and I recently began treatment here, and I really do believe I've been experiencing a clear breakthrough in my pain. If you've been suffering pain needlessly, please come in and make an appointment now.